Having an artificial joint is a serious decision, and it's not to be taken lightly. It's a big operation that comes down to the question of, is my life being compromised to the point that the risks are worth it? And there will be a day, and you will know it. You will know it better than I will know it, that I am done suffering. I deserve something better. This is compromising my life that I'm not going to put up with anymore. Arthritis, it can be caused by a bunch of different pathways, and the most common is osteoarthritis, where your joint is just wore out. The cartilage that lines the ends of the bone that makes it a gliding surfaces have eroded away to the point where it's no longer a no-stick surface. It's now like driving down a gravel road, and that causes a chemical reaction inside the joint called inflammation, and that inflammation then causes pain, and then eventually you start eroding the joint away, and the bone becomes malaligned, and then and you lose motion, and that inhibits your function. So it's functional compromise, it's and unrelenting pain. Knees, hips, and shoulders they're a lot alike. We're replacing a normal bone and joint surface with a metal and plastic device. And we know that if we replace your joint, we keep you active, you live longer, and your life is more satisfying. That's unequivocally true. Obviously, the easiest thing to rehabilitate from is a total shoulder. One of the reasons is we don't walk on our shoulders. You need 2 hips to walk, you need 2 knees to walk. You only need 1 good shoulder to get by in life. And so shoulder arthroplasty or replacement is the easiest thing to recover from. Generally speaking, in 6 months, you're pretty much on autopilot. You got your life back. And after 6 weeks, you're really doing 90% what you'd normally do in life. Hips, so I'd say would be it might be the biggest operation of the 3, but is one of the easier ones to recover from, far easier than a knee. And hip arthritis really limits you at a greater level than shoulders and knees do. Knees intermediate as far as the magnitude of the operation between the hips and shoulders, by far the hardest to get over. It's by far the most frequent of the 3 joints, major joints that we replace, and there's a lot of therapy related to the knees, and it needs to be done, and you need to achieve the therapy goals at a particular time. The orthopedic surgeons here have added training. We all have a notable amount of experience. Each of us that are here now have done thousands of joints. Having an artificial joint, if you have unrelenting pain that keeps you up at night, and we replace it and we take away that pain, it literally gives you your life back.